aorta descendens and branches of aorta descendens and blood supply of main organs. Aorta descendens is a continuation of arch of aorta, and this part of aorta begins on the level of corpus fourth thoracic vertebrae, lie in posterior mediastinum, some laterally on left side from the columna vertebralis. In thoracic cavity, this portion of aorta is called aorta thoracica descendens. Gives branches of two types of branches. Parietal branches, which supplies walls of thoracic cavity and diaphragm, and visceral branches. Visceral branches supplies organs of posterior mediastinum, such as esophagus, rami esophagealis, then rami brachialis, rami pericardialis, pericardium, and mediastinalis for the tissue of the mediastinum, for lymphoid tissue, fibrous tissue, and adipose tissue. Parietal branches supplies intercostal spaces, arteria intercostalis posterioris, and these arteries gives branches to deep muscle of the dorsum and to the skin of dorsal surface, and ventral branches to the intercostal spaces. These arteries makes anastomosis with intercostal anterioris branches of, as you remember, this artery. What name of this artery? Thoracic artery. Okay. And diaphragm is supplied by the branches of thoracic internal artery and arteria phrenica superior from the aorta. Then, after hiatus aorticus, aorta lie in abdominal cavity, retroperitoneally, some laterally from the central line. Here, this aorta abdominalis. Aorta abdominalis gives some branches in abdominal cavity. Parietal branches, such as lumbal arteries, paired lumbal arteries. Four pair of these arteries present in lumbal region. Then, parietal branch to the diaphragm, arteria phrenica inferior is branch of the gastrica sinistra arteria. Arteria phrenica inferior. And visceral branches of two types, paired branches and unpaired branches. Paired branches supply paired organs in the abdominal cavity, such as kidney, suprarenal gland, and gonads. To kidney runs arteria renalis, here you can see, arteria renalis, dextra sinistra. Then arteria suprarenalis. No, I cannot show now this artery. I will show only vein with the same name. Arteria suprarenalis media. And arteria testicularis in our case. This artery arises from anterior surface of aorta on the level of second lumbal vertebra, and has the same view as this testicular vein. It's very long, thin artery, because in embryonic period, gonads, ovarium or testis forms on the level of first lumbal vertebra, and then run in downward direction during the embryonic period, and ovarium run to the level of the superior aperture of lesser pelvis, but testis run through the inguinal canal in the scrotum. That's why arteries and veins of these organs so long and thin. It's paired, three paired arteries. And unpaired branches of abdominal aorta supplies organ of digestive system, because all these organs are unpaired. First branch, truncus celiacus. Truncus celiacus. Celiac trunk, very short, arises from anterior surface of aorta on the level of 12 thoracic vertebrae, and gives three main branches. Arteria hepatica communis run to right side and supplies branch of these arteries, such as arteria gastroduodenalis, this beginning of this artery, gastroduodenalis artery, supplies pancreas, duodenum, upper portion, arteria pancreata duodenalis superior, and supplies lesser curvature of the gaster here in lower part. On left side from trunk arises arteria gastrica sinistra. This gastrica sinistra lie on lesser curvature too, and anastomosis with arteria gastrica dextra from gastroduodenal artery on the lesser curvature supplies gaster here. And last branch, arteria lienalis. No, lienal artery was destroyed here, only beginning present. Arteria lienalis lie in horizontal direction on left side and supplies first of all spleen, then gives branches to the posterior surface of the gaster and supplies corpus of the pancreas. Next unpaired branch lies some below on 1-2 centimeter. This artery is called arteria mesenterica superior. This artery arises on the level of first, second lumbal vertebrae, then runs between layers of visceral peritoneum to the radix mesenteric and supplies. One branch runs to the pancreas and duodenum. This branch is called, now I hope that this branch absent now. Arteria pancreata duodenalis inferior supplies head of the pancreas and lower part of duodenum. Then arteria iunalis supplies iunum. Arteria ilealis supplies ileum. And arteria, now I must... Ой, как сложно. Arteria cecalis supplies iliocecal angle and cecum anteriorly and posteriorly. Arteria cecalis anterior, posterior. Arteria to appendix, arteria appendicularis supplies appendix. Arteria colon ascendens supplies colon ascendens. And colica media supplies colon transversum. All these parts of the intestine, all small intestine, and bigger amount of large intestine are supplied by the branches of mesenteric superior artery up to left curvature of the large intestine. Then below from left curvature, colon descendens, sigmoidum, and rectum, upper portion, are supplied by the branches of this last unpaired branch of abdominal aorta, arteria mesenterica inferior. This artery gives arteria colon sinistra, rami sigmoidae to sigmoid colon, and arteria rectalis superior, which supplies upper portion of ampulla recti. These all unpaired branches. Then, for next time, you must know all branches and topography. It's first. Second, you must tell about blood supply of organs, such as blood supply of the gaster. Gaster has two curvatures. On the lesser curvature, anastomosis. Arteria gastrica sinistra is branch of truncus celiacus. Arteria gastrica dextra is branch of arteria gastroduodenalis. Then, on greater curvature, anastomosis, two branches. Arteria gastramentalis sinistra is branch of lienal artery. Arteria gastramentalis dextra is branch of gastroduodenal artery. Posterior surface is supplied by the rami gastrici brevis, are branches of the lienal artery. In the region of cardiac part of the gaster, near the esophagus, rami esophagealis, anastomosis with rami esophagealis from thoracic aorta. Rami esophagealis in abdominal cavity arises from the gastrica sinistra artery. Here present anastomosis between thoracic part of aorta and abdominal part of aorta. And in lower portion of gaster, near the ampulla duodeni, branches of arteria pancreatica duodenalis superior supply this picture. You must tell about each organ, such as about gaster. Duodenum, pancreas, large intestine, small intestine. And glandula suprarenalis has difficult blood supply. Glandula suprarenalis is supplied by 3 suprarenal arteries. Arteria suprarenalis media arises from aorta. Arteria suprarenalis inferior arises from the renal artery. And arteria suprarenalis superior arises from the arteria phrenica inferior or from the phrenica inferior. That's all. Next time you must show all unpaired branches which present in our dead body. Shagan, it's for you. First of all, unpaired branches. Now you have time to see dead body.
Make a study.